sports, pop culture, all kinds of different stuff here. But we haven't talked a ton about COVID-19. I think what you guys addressed there with contact tracing is so crucial to sports coming back. We see it in all kinds of different leagues, all kinds of different levels right now, that contact tracing is the essential component of getting back, getting fans in the stands, just kind of getting society back to normal in general. And you heard that in the early days of this pandemic, that the big three things are going to be testing, contact tracing, and then those, virus passports that you hear about as well. See who's positive, who's not, who's been tested, all that stuff. So contact tracing is your thing. How'd you get into it? How did this kind of become your thing?
It's an interesting backstory. So the company started out as a medical device company. They've been, working on wearables and Bluetooth beacon technology since about 2013. And one of their first medical devices was an infant monitoring hospital bracelet. So right when the baby's born, they get an infant kind of, it looks exactly like a hospital bracelet. They put it on the baby and it would sort of keep tabs on where the baby was, if it needed to be sent for a test, make sure that, there's the test results were recorded, came back, make sure there's no mix-ups or switching happening, because in a maternity ward setting, you have all these multiple redundancies. Like this is the most sensitive population in the world.
Yeah.
So, bringing a technology that helped that was important. So that was up and running in several hospitals around the world. And I think, background wise on the technology, coming from that maternity ward is pretty important because it's really speaks to, if you're in a hospital setting, the privacy is so critical, right? Obviously your medical records, everything that you want to keep private is ultra important. That's the most private setting effectively people go in with their doctor and medical professionals. Security and being able to integrate with all the access control systems in a hospital is important as well. And then also just the safety of the actual wearable. So the engineering that goes into the wearable, the battery, any sort of making sure that the frequencies and the actual kind of transmission is super low and super safe, even safe enough for a brand newborn infant. So those are the big things: is privacy, security, and safety. So that's the background of it. But the real breakout came. Hong Kong was one of the first countries to do an inbound quarantine program.
Yep.
And so that meant, when they first welcomed travelers back to Hong Kong, they were just giving them, a chat app, and saying, make sure you self-isolate and don't go out. And they just found that people weren't sort of listening to it. So they wanted to get a wearable involved so that there'd be a Bluetooth wearable associated with a person that would also pair with the cell phone. And that really helped. And again, it's a privacy enhancing thing to make sure that the wearable that we designed for that, which was an extension of the infant tracking product, to make sure that the battery would only last effectively for the quarantine period. So you couldn't be tracked after your quarantine and so on. And, you can cut the bracelet off after the quarantine is over, and there's no sort of residual, privacy issues. But that was for Hong Kong. We've since refined the product substantially. So now we have an enterprise product that is not necessarily a bracelet. Nobody wants to wear a bracelet or something like that at work.
Yeah.
So we integrate the wearables into whatever people are using at their workplace. In Singapore, it builds right into the hard hat that people wear at work or the safety equipment they're wearing. We're at the World Juniors up in Canada, the hockey tournament, and in that instance, we're building it right into the credential, like your actual venue credential. So we're making it so that it's a wearable, it's unobtrusive, and in that case, you're not pairing it with a cell phone. You're pairing it with the newest versions of the product don't touch a cell phone at all, because we think that that's a major privacy thing. It only works at the venue itself. it can't be connected to anything after that.
So I took some classes in technology at school. I just graduated last year at Syracuse, and the first intro to that class I took, it was the first time I heard about technology like this, that low-level Bluetooth. And the way they used it was they had a thing in the classroom, and they started making us get an app on our phone, and they used that to do attendance. So I mean,
Oh, wow.
20 years ago, this is a class of like 100 people. So if you ever missed this class, you'd be all set. They'd never know. But now we had this Bluetooth thing, and if you were absent, they knew there was no way around it at that point. So that was my introduction to this. But I think this is a much better use here with the contact tracing. So it looks like around June that you guys really started to rebrand the company around contact tracing in particular. When did it hit you that this would be an opportunity for you guys and that this pandemic was something serious? Because we knew about it since November and we were hearing about it in the news. It was in
Yeah.
Asia, and then it starts slowly making its way through Europe to here. When did it hit you that this was going to be something that really affected Canada, the United States? And when did you see it as an opportunity for the company?
Well, I mean, I like to say we're really active in Singapore. We have an office there. We have a huge sales force over there. And, being in Asia sort of is like having a crystal ball 5 months into the future.
Mm-hmm.
So, like you said, it started emerging in November. By March, we were in the throes of it. And our first order from Hong Kong, I think, happened sort of late January, early March, or sorry, early February. So they were already starting to grapple with, closing, trying to restrict travel and make inbound travel as safe as possible back then. So I think it was really early February was the first time, and the order quantities were large, right? Like you're talking about 20,000, 50,000 at a time, and so at that point, when you look at the volumes we were doing in certain hospitals, then you start looking at, wow, these guys are ramping up their volume fast. That was a big eye opener for us, just the volumes.
Mm-hmm, for sure. And so what did that say to you when you started seeing those volumes, when you started seeing that countries were going to want this? Like, what did that kind of inspire you guys to do?
Well, it definitely said this is a lot more serious than I think it's being made out to be.
Yeah.
I mean, it's hard. There's been a whole, genesis. It's been a roller coaster ride as far as public perception and sentiment around what's going on. And at that point, January, February, it was very under the radar for people, and that really piqued our interest. That maybe this is something that we should keep. That's very serious. And the Hong Kong, that community had already gone through the SARS, so they sort of had muscle memory about what this sort of means, how serious it can be, how fast it can spread. And they also have Singapore and Hong Kong, just the density of the population there. It's really like they can't do as much as we can in Canada and the United States to actually social distance, because just like there's so many people in such a small area. So for them to be taking it that seriously just kind of let us know that, wow, this is much more serious than I think we're taking it at the time. And there might be major needs for these types of products going forward.
So let's talk sports. I'm going to bring Syracuse in again here. They've been starting their season again. They getting back into their camp, and then they start the season here. They're getting into the first couple of games, and about 6 games in, they have a case. One of their walk-on players gets it. They had been wearing devices like these, so they got contact tracing between the players, the coaches, all those different people in there. And so the walk-on gets it. He's obviously out of competition there, but one of the players, through the wearable device, was known to come in contact with that walk-on player. Now, he wasn't positive. He tested negative, but he was held out of competition for the next 2 weeks because of that, contact with the walk-on who was positive there. So that's one of the uses here. You've talked about the different alliances that you have, whether in Canada or TD Garden or these different places. They all have different policies, obviously, for how this is going to work. But in general, what's kind of the goal of this contact tracing, and what's the uses that you're seeing of these devices in the different organizations that you've partnered with?
Yeah, I think you hit it right there. Like that is the use case. And I mean, whether or not the policy around him being off for an additional 2 weeks is the right balance. Maybe it's less, maybe it involves a test. That's up to sort of the leagues and the health officials in the area and all those sort of things. That's really kind of a policy question. But I think the idea of the contact tracing and it working, like that sounds like a situation where it worked correctly. Although I'm not familiar with that exact incident and what all the details are. But that's really it. I think the enterprises that use the product, particularly around their workforce, they're basically saying, we don't have a lot of control over every variable in people's lives, and we don't want to do that. But at our workplace, we want to be able to see who's interacting with one another in case someone does come in contact with that. And it means that we can take a very targeted approach where we could put 1 or 2 or 3 or however many people were exposed. We can put those people on leave while the rest of the team or the rest of the workforce or the rest of the staff can continue working. I think the biggest problem with this pandemic has been business continuity getting interrupted and businesses getting shut down and all that kind of stuff. And we really want to do whatever we can to keep business and economy moving because that's so important to people's livelihoods and everything else. So that's one area where I think we can help. If you look at a really complicated example where you have like tens of thousands of workers and you have people that they have complicated supply chains where you have people that have to move between plants or even countries, like different manufacturing lines in different areas. That's an area where there's huge things at stake, right? Sports there's a lot at stake. There's games, there's players and everything else. But in a manufacturing situation like that, like if that whole situation goes down because someone gets COVID and they can't figure out how it is potentially spread, they run the risk of having to shut the whole thing down. And that's 10,000 people, off work. So in those cases, we see those companies really trying to hone in so that they can get that sense of confidence around business continuity.
So the NBA shuts down in March. They do the bubble over the summer. You got them going back in stadiums this year. One of those stadiums is TD Garden that you guys work with. And they're of course owned by the Bruins. They're an NHL building, but the Celtics are in there as well. How'd that partnership come together? Was it more them reaching out to you for this product, or were you guys pitching this to different sports and arenas all over the North America?
So it's actually them reached out to us, and it's a really impressive organization there. The Delaware North group is we were super impressed with them, their knowledge of the different products and all the protocols that they put in place, all of the building blocks and pieces to reopen. I think they took a very smart approach. And but yeah, they did some outreach to us, and we've been working, to deploy the technology with their group.
And what are some of those steps they're taking with your technology for employees? I'd imagine, concessions, people just working around the stadium in general.
Yeah, I think there's a combination of the full-time people that work at the stadium, plus, there's always going to be people that are coming into work on various things for, maybe a day or maybe, a longer stint, but not necessarily, permanent full-time employee. But this program covers the whole thing. So there's a series of, permanent, they're just essentially clips that attach to their credentials. So that would be what the full-time people wear. And then the people that are going to be visiting are going to have more of a disposable form factor that they can just wear for however long that is. And then when they leave, that's it just goes in the garbage. So there's a longer live product that for the full-time people and a disposable product for the short-term guys.
And Friday's going to be that, or tomorrow actually is going to be the first testing day for that. They're going to have their first event there since this whole pandemic went down with the preseason game between the Celtics and the Nets there. No fans for now in Massachusetts. We'll see when that starts to turn around, but the numbers aren't great here. Things aren't going that well with COVID-19. So I'd imagine it's going to be a little while before you start to see fans in the stands there. So what's that rollout going to be like right away there for TD Garden? It's not going to be a whole lot of concession work or anything like that, but what's going to kind of be like that first testing ground, the first steps now, even though there's no fans or really, many people at all there?
Yeah, so there, I mean, yeah, you're right. There's no fans, but it's still a significant, organization there. So there's several hundred people that are going to have the devices, and yeah, I mean, to the point about the fans, I'm not sure when fans get reintroduced and how the TD Gardens and the various sports organizations will handle that and which steps they'll take. Time will tell how that all plays out. I think it's has a lot to do with um, the health authorities and what they, how things are going in each region. And then, obviously like just fan willingness, like how much people want to get out and get into a crowded stadium right away and how that kind of ramps up. I tend to think that it's going to go back faster than we think. I think people are dying to get out and see sports and do things. They just want to do it in a safe way.
For sure. So what do you kind of know about what TD Garden's plans are for this season? You talked a little bit about fans there. You got media. There's just a lot of different personnel in there. You guys are focusing on the employees, but there'll be interaction between employees and people who maybe aren't wearing this device. Like, is there something to kind of bridge that gap there between the employees who are going to be tracked and eventually the people who are coming in from the outside there?
I think that's a part of their scaling plan. So I don't want to speak on their behalf about exactly how they're planning on doing that. I know they're very thoughtful and they have thought of all these various all the eventualities. Like they're a professional group, so I don't want to speculate as to exactly how they're gonna do things, but I know we're going to be there to support them as best we can with the devices. And should they choose to expand it or sort of augment, we'll work hand in hand to make sure they have the right type of device that they need based on the feedback that they see going forward. I mean, I'm sure there's going to be there's always little issues that you don't foresee, and it's always a bit of a learning process. So hopefully that shows us where we can improve and what we can do.
It was Wayne Lloyd, CEO of TraceSafe. Last question before we get you out of here. What are your goals for 2021 with the company? With kind of just, what do you hope to see your company be able to accomplish with mitigating this pandemic into the next year? We got vaccines coming out in the US and around the world. But, we still hear there's still going to need to be masks based on how this works. There's still going to need to be social distancing. And of course, there's still going to need to be contact tracing around the country, around the world to some degree in the next year. So what are your goals for the company, and what do you want to kind of see the world accomplish in this next year?
I think, like I said, I think things are going to go back to normal faster than we think. We sort of, like I was saying, you kind of have this crystal ball looking, through to Singapore and all the work we're doing there. What they're doing there is they're transitioning the contact tracing we're doing in construction, the hard hat stuff. They're turning that into the central point of like the central thing for all the other stuff that has to do with a connected worker. So as far as safety is concerned, whether someone's climbing up a ladder, whether someone's operating a piece of heavy machinery, whether there's a piece of heavy machinery close to you, your safety device and your hard hat can understand how close the heavy machinery is. So what they're doing in Singapore is they're taking these wearables that have been introduced into targeted workforces, and they're using that to level up their game as far as safety, make sure people aren't getting injured at work, making sure that people are kind of doing better in ways of performance and wellness and stuff like that. So really, that's the focus of the company, is taking our devices and making them center of a connected worker strategy, and that's like wellness, safety, and performance around what happens on a job site. Construction is really in Singapore leading the way, but I think there's other areas like cruise ships. We're doing the devices themselves kind of become a central focal point. So integrating the device with payments and room keys and all that kind of stuff. You're going to see these wearables become the focal point of a lot of activity, which I think is good, because you have the alternative is that everything sort of gets built into your phone. Your phone is a kind of a private place. You don't necessarily want to have everything to do with your work on your personal device. it's really kind of a wear at work, stay at work strategy. Like your hard hat, like that hard hat doesn't need to follow me to the bar after work or something like that. You know what I
Yep.
mean? Like I don't need my employer tracking me, when I'm not doing my job. So I think the idea of that, those pieces of functionality getting built into workplace wearables is a huge trend for 2021. And I do think Singapore is back to 0 cases, right? And I do think that we're going to get there very fast. And I see 2021 as very optimistically.
Wish the U.S. thought those out the way Singapore did. It's there's a whole nother conversation there to be had about the U.S. response to this. But we appreciate the work you're doing. We wish you the best of luck in 2021. Wayne Lloyd, TraceSafe, check them out. Check out their story, and they'll be handling TD Garden's return to sports this year. Appreciate you.